Welcome back, everyone, to another exciting episode of We Heart Therapy. You're watching the series, Your Guide to Therapy and Coaching. I'm your host, Anabelle Bugatti, and today's special hot topic, we're talking about maternity mental health. And with me today, I have special guest, Jazmine Ortiz. She's a marriage and family therapist in California, and she's going to talk to us all about maternity mental health. Thank you again so much for joining us today, Jazmine.
Hi, thank you for having me.
Thank you so much. So, Jazmine, could you talk to our viewers a little bit about what the emotional or mental health concerns that may come up during pregnancy?
Sure, there's a series of concerns that may come up during pregnancy, such as, it's during pregnancy can be such an emotional roller coaster. Some of the changes that happen during pregnancy are hormonal. There's lots of self-esteem, lots of self-body image. There's a lot of health issues also that are going on for some women. And for new moms, this can also be very mentally draining.
Yeah, so it sounds like, on top of pregnancy being exciting and fun, it can also be mentally draining. And with the hormone fluctuations, of course, that can cause shifts in our mood and personality.
Exactly.
And sometimes we may not feel like we have the coping mechanisms to get through it, right?
Right, exactly. Which is actually there's a lot of some of the mental health issues that happen are issues like OCD, depression, anxiety, and there's actually all of this happens with the general population, but with in particular women that are pregnant, there is a 20% higher in interest, a higher rate with women that are pregnant where all these things happen.
Yeah, so it sounds like some disorders like OCD are starting to arise during pregnancy.
Mm-hmm. Yeah.
Wow. So why would it be important for a woman who is getting pregnant or thinking about getting pregnant or going through her pregnancy, why would it be important for her to come in and see somebody?
Well, by seeing somebody like myself, it is important for them to come in and speak to a professional that is trained with the many different topics that come up during pregnancy. It is, like I said, it's estimated over 20% of childbearing women that experience anxiety and depression, OCD, and also as well postpartum. So it is important to tackle these issues or early onset. Prior, if you don't, it can lead to suicide, and you want to make sure that the baby and the mom are safe.
Right. So of course, it's important for pregnant women or postpartum women to not just let these things sort of pass them by and think, oh, it'll just get better. It's important for them to find a helpful therapist in their area to talk through these issues, right?
Of course, yes.
Absolutely. Now, do you think that and it may be quite obvious, but a pregnant woman or a woman experiencing postpartum depression, do they necessarily have to find a female therapist? Are there any male therapists who specialize in this area?
Right. There actually, there's a lot more women that are women therapists that specialize in the area. As far as men, there's not that much. However, it's like, finding a therapist, it's all about seeing who you can click with. So by taking those 15 minutes, calling them and asking a series of questions just to see if they're a good fit, I think that's the best way to find somebody, to see if you're going to be a good fit, whether male or female.
Right. Though they probably might feel most comfortable seeing a female therapist after all this more.
Of course, yes. There's a lot of talk. Yeah.
So what would a typical session look like for somebody who's experiencing some postpartum depression or pregnancy anxiety or OCD?
That's a great question. Depending on the symptoms that the mother or the new mom, the new mommy to be is experiencing, sessions are tailored depending on the needs of the client. So it provides an environment for them to feel heard, validated, and enjoy the special time really with their growing family, because it really is a special time, even though there are so many changes that are happening in a woman's body.
Yeah, so it sounds like finding a therapist or a counselor to work with during this time can sort of help women get some of that stress and the hormonal issues, learn how to cope with those in a way that's emotionally, mentally healthy, and sort of make way for the path for this to be a really exciting time in their life.
Exactly.
Excellent. So how can somebody find a therapist in their area who specializes in this type of therapy?
Great. There's a online source. It's called postpartum.net. So if you go to www.postpartum.net, there is a list of a couple of therapists and resources on maternity mental health, and someone can connect you.
Excellent. And possibly Google, could they just Google, maternity counselor therapist in their area?
Yeah, they can do that. More than likely, they will end up on Psychology Today. So Psychology Today is also a great resource of finding someone who specializes in maternity mental health.
Excellent. Now, if somebody is in California and they'd like to work with you, how can they find you?
Sure. They can find me at www.sandboxfamilyservices.com, or find me also under Psychology Today under Jazmine Ortiz. Or they can also reach me at my office line at 626-578-5501.
Excellent. And we're going to put a link to your information in the drop-down box. So if you're in California and you're interested in working with Jazmine, you can certainly find her and work with her. And of course, you can always check us out at wehearttherapy.com. Thank you again so much, Jazmine, for joining us on this special topic about mental health during pregnancy and postpartum. And again, as always, if you like what you see here today, more episodes are on the way, so sit tight and subscribe to We Heart Therapy. Thank you again.